Our body has an amazing way of hiding a multitude of symptoms that you would just put down to being pregnant. Fatigue, aching bones, swollen breasts, all of the red flags.
You just want to be there for those little momentous moments. You want to see their first steps. You want to see your oldest child go into senior school. You want to be there for these things that we take for granted.
For me, the hardest thing is the fear of being, not there for them.
In June 2017, I was diagnosed with stage 3 inflammatory breast cancer. My daughter had just turned 1. It was already spread to my lymph nodes. They were looking to cure me, and everything just happened really quickly. Inflammatory breast cancer is quite a rare, aggressive form of breast cancer. So it was like, there was no stopping. So a week after that, I was in chemo. I lost my hair. My eyelashes, and then I went straight into radiotherapy, and then I had my mastectomy and node clearance, and then I showed clear margins, which means that they got it all. And then I had some really bad hip pain at night, and I was literally at the end of my consultant's meeting, and I was going to leave, and I just said to her, I was like, oh yeah, my hips are really hurting at night. And she was like, what? And I was like, I don't know what it is, they're just waking up and it's a really, really strange pain. So she was like, okay, so sent me for a PET scan that day, and it came back that actually the cancer had progressed into my bones.
I'd been diagnosed just after my 29th birthday, and at the time I was 15 weeks pregnant. I had checked my boob, and it was almost like my hand was a magnet. It went straight to the lump, which I'm so thankful for, because I don't think I'd have found it for another good couple of months, because although I was breast aware and I knew to check, I didn't check every month. So I was just really thankful. On that evening, I found the lump. I rang my GP the next day. They got me in really quickly, which was fantastic. However, I was met with, you're too young, you're pregnant, this is nothing to worry about. I left, and there was something in me telling me, something's not right. These are not your pregnant boobs. I think I waited 2 weeks in the end, and even then I rang up and I thought, hi, I wasn't told to come back until 4 weeks. I want to make the appointment sooner, is that possible? And they're very accommodating, and they got me in. I was referred, and thankfully was seen a couple of days later, and that's just when my world came crashing down, to be told it's not quite as innocent as we first thought, and you need to consider what you're going to do with your pregnancy, at which point I was in total denial. This is not breast cancer, I've been told, and it was breast cancer.
I went to my GP, it was a guy, quite a young GP, and he clearly didn't feel comfortable checking, because he said, it's probably hormonal, don't worry. And I didn't get checked, and so I wasn't comfortable with it. It hadn't gone away. I waited 2 weeks. I thought it'd grown a bit, which is another sign. So I went back and got an immediate referral and was diagnosed within a week with breast cancer.
The best thing about being a mum is watching your child smile and giggle for the first time, watching their little personalities like flourish, watching them grow into themselves, seeing for the first time what sort of little human they're going to be, and what their interests are, and just watching them every day. And I think it's something you take for granted, but when you look back and realise how quickly time's gone and how many amazing memories you've shared with your children in that time, it's so rewarding. Like, children are amazing, and I am biased, but my kids are my world, and they are absolute little rock stars. I love them to pieces.
What's the hardest thing about being a mum?
I'm getting emotional already. For me, the hardest thing is the fear of being, not there for them. When they wake up in the night from a bad dream, or someone's picking on them at school. Yeah, the hardest part about being a mummy is worrying that I'm not going to be a mummy for much longer.
What does it feel like to get a diagnosis as a new mum?
Oh, it's gut-wrenching. It's just because you don't want to be upset. Because you want to leave a happy... It's soul-destroying and exhausting. The chemo's only going to work for a certain amount of time. For me, like, the pressure of just trying to get everything right is a lot.
Shocking, frustrating. I was angry. I thought, why me? All the time you're thinking in your head, am I going to die? Am I going to leave my kids? Who's going to look after them? Will they remember me? And especially when your children are so young, you just want to be there for those little momentous moments. You want to see their first steps. You want to see your oldest child go into senior school. You want to be there for these things that we take for granted. You want to be there. You want to see it all. But when you're told you've got cancer, that's not the case for everybody, and they don't get to see those moments. They don't get to see their children grow up.
Terrifying. All the joy of motherhood is taken from you. I remember thinking, I just want this baby out. I kind of lost my connection because everything was focused on, I was thinking about my parents at the time as well, like, are they going to lose me? And I just need to get this baby out. And before, it had been such a wondrous experience. I couldn't wait. We'd tried to have a baby for quite a long time, and then it had gone from the nerves of giving birth and wondering what kind of birth I was going to have to just please get the baby out and get the boob off. I just wanted the breast removing. And I remember when she was born, she was incredible. And I remember I tried. I told myself I didn't want to bond with her because I didn't want to leave her. I was so terrified of her not having me. I didn't want her to want me because I thought I was going to die, and I just didn't want her to have to lose me, to be connected with me. But the minute I saw her, it was, an incredibly overwhelming feeling of, I'm going to do it for you. I'm going to get better for you.
I think pregnant women and new mums just need to know their own body. There's nothing special that you need to know in terms of checking your boobs. Nobody knows your body more than you, and it's about knowing what's normal.
And our body has an amazing way of hiding a multitude of symptoms that you would just put down to being pregnant. Fatigue, aching bones, swollen breasts, all of the red flags. It all comes part of being a mother.
I think GPs are great, but they're not specialists in anything. So go back. If they say no, ask them, are they 100% sure that it's nothing to worry about? Because a GP won't tell you they're 100% certain. And in that case, get your referral, get seen immediately.
Because the earlier you catch it, the better chance you've got. I ignored so many symptoms, and every day I have to actively not rip myself apart because I ignored them. So yeah, just don't ignore, because life is just too precious to keep putting yourself on the back burner. And I think that's what women do, mums do. The newborn baby gets 2-week check, 8-week check. Where's our checks?
You know your body more than anybody else, more than any other professional. So be an advocate for your own health.